A new government report shows improvements in the mental health of young people across the nation. According to the CDC, students who experienced overall feelings of sadness and hopelessness dropped from 42% to 40% when comparing 2021 to 2023. For girls, it dropped from 57% to 53%. Joining us to talk about the significance of this study and some other health topics today is Dr. Bill Hartman, clinical trialist at UW Health. We always love having you along for these segments. You know, in this one particular, I know we're highlighting the fact that things are going at least in the right direction when it comes to mental health of young people, but a few percentage point drop doesn't really seem all that significant to me. What really stands out, Dr. Hartman, is how high the numbers are to begin with. What do you think?
I totally agree. The numbers are extremely high. You know, for the last 30 years, the CDC has been following the mental and physical health of high school students using this risk behavior survey, youth risk behavior survey. And through it, they did see, especially at the height of the pandemic, that 42% feeling sadness and hopelessness. It has reduced to 40%, but that's still 10% higher than we were just 10 years ago. So for whatever reason, we're still stuck in this real mental health crisis. We really have to be on the lookout for our teens and make sure that we're doing all the things we can to support them.
And especially when it comes to the girls. I mean, the numbers of 57% down to 53%, that still means that 1 in 2 girls feel the sense of sadness or hopelessness. And even as a mother of a daughter who's only 6 now, I mean, that raises red flags for me. Like, I really need to be paying attention because this is a pretty prevalent situation, right?
Right. And being the father of a girl who's 12 years old, we had this talk today. How are you feeling? How are things? How are your friends doing? Trying to, at least open the door to these conversations so that she knows that she can be comfortable. And I think that all of us as parents really have to take to the forefront and really address our kids to make sure that things mentally and physically are going in the right direction.
So much can just be brushed under the rug. You are absolutely right about that. You have to open that door, create that safe space to talk. Totally switching gears here, there is a warning about a disease that we don't see all too often, but more cases and deadlier cases are popping up across the world. And now doctors here in the U.S. are getting the warning to be on the lookout. What do we need to know about Mpox, formerly known as monkeypox?
So Mpox, like you said, formerly known as monkeypox, usually is concentrated in Central Africa, a country called the Congo. But recently, they're starting to see cases spread around to the surrounding countries. And so the WHO and the CDC are both concerned and keeping an eye on this to make sure that the spread can be contained. But in particular, this version of Mpox, the so-called Clade 1b version, tends to be more deadly, more lethal than the original Mpox that we saw even in the United States last year. The other concern is that it seems to be targeting kids under the age of 15. And so this is really something that the world is got a close eye on right now to make sure that these cases don't spread beyond what they are right now.
And a lot of times the symptoms are really those like spots that you see on your skin, right?
Right. Spots you see on the skin, you fever, chills, general flu-like symptoms. But it has gone from about 1% lethality to 4% lethality. And so this is really something that is concerning and something that we should all just be aware of.
Without a doubt. All right. Well, Dr. Hartman, we appreciate it. Thank you.
Thank you.